Good day, I am Girlie Quibuyen from BSN 4-4, and now is I'm going to be doing the demonstration about cleaning an open wound and applying a dry sterile dressing. So for the purpose of this procedure is to promote healing of the wounds without microbial infection, and also help speed up the healing process with less scarring, and lastly, to protect the wound from any further injury. So for the assessment po is I will now assess the patient. I'm gonna assess the wound history, the duration, location, character, size, and odor. So good day ma'am. I am your student nurse Girlie Quibuyen, and I will be your student nurse for today from 7 a.m. to 3 p.m. Can you please state your name and your date of birth, ma'am?
My name is Evangeline Cuevas. I am 36 years old.
Ma'am, i-assess ko lang po yung wound niyo po. So, ma'am, tatanong ko lang po kung gaano katagal na po yan. Kahapon lang po. Now po is I'm gonna assess the location and its size. So, ma'am, i-measure ko lang po yung size po ng wound niyo po. So, after that po is I'm gonna assess the peri-wound or the wound surrounding, and I'm gonna observe for any damage. Okay, ma'am. Thank you. So, next po is I'm gonna assess for the pain, the severity, its duration, and also its location or any signs of infection. So, ma'am, itatanong ko lang po if in a scale of 1 to 10 po, the 10 being the pinakamasakit po, ano po yung scale po sa tingin niyo po?
4 lang.
4 lang po yung sakit. Okay, ma'am. Thank you po. So, next po is I'm gonna assess the patient for possible need for non-pharmacologic pain, reducing interventions or analgesics medication before wound care dressing change. So, since the patient said na 4 lang po yung pain scale, hindi na po natin kailangan yun. So, now po is I will now gather and prepare the following materials, which is the micropore, the ruler, the sterile gas, which is nandito po sa loob, and also yung cotton balls po, which is nandito din po sa loob, and as well as the sterile cleaning solution or yung irrigating solution, the sterile wound cleaning set, which is andito po, and as well as the kidney basin and the 2 forceps or the 2 curved Girlies, and betadine if needed, and also the elastic bandage. So, after that po is I'm gonna check and verify the doctor's order for wound care or the nursing care plan of related to the wound care. So, check ko lang po. So, after that is I'm gonna identify the patients with at least 2 identifiers, and I'm gonna explain the procedure to the patient and to the family. So, good day ma'am. I am your student nurse Girlie Quibuyen. Ma'am, can you please state your name po ulit?
I'm Evangeline Cuevas. I'm 36 years old.
Your date of birth po, ma'am.
September 15, 1986.
Okay, ma'am. So, ngayon po is ang gagawin po natin is the cleaning and open wound and also applying dry sterile dressing. So, yung purpose po nito is to promote healing of wounds without any microbial infection, and also help speed up the healing process with less scarring, and lastly po, it will help us to protect the wound from any further injuries po. All you need to do, ma'am, is to follow some of my instructions and be comfortable with me all throughout the procedure. Is it okay for you, ma'am?
Yes.
Okay, ma'am. Thank you. So, after that po, is I'm gonna gather the necessary supplies and bring to the bedside stand or overbed table. So, here is the materials needed. So, next po is I'm gonna place the patient in appropriate position, either semi-Fowler's or high Fowler's position, and of course, I'm gonna provide privacy by closing the door and pulling the bedside curtain. So, ma'am, comfortable naman po kayo sa position nyo? Okay po. So, after that po is I'm gonna perform hand hygiene and put on PPE if indicated. So, after that is I'm gonna inspect the wound site for its size, appearance, and drainage. And I'm gonna measure the wound size using a ruler, like what I've done earlier. And I'm gonna assess if any pain is present and check the status of sutures, adhesive closure, staples, and drains of tubes if present. And I'm gonna note if there is any problems to include in my documentation. So, ma'am, assess ko lang po. So, na-check ko naman na po yung size po niya and location. So, after that po is using a sterile technique, I'm gonna prepare a sterile work area and open the needed supplies. I'm gonna open the sterile cleaning solution depending on the amount of cleaning needed. And the solution might be poured directly over the gas or sponges, or over a container for small cleaning jobs, or into a basin for more complex or larger cleaning. So, after that po is I'm gonna put on a sterile gloves. So, after that po is I'm gonna clean the wound. I'm gonna clean the wound from the top to bottom and from the center to the outside. Following this pattern is I'm gonna use a new gauze for each wipe, placing the used gauze in the waste receptacle alternately, and I'm gonna irrigate the wound from top to bottom with an irrigating solution or commercially prepared wound cleanser. So, ma'am, i-clean ko lang po. So, once the wound is clean, I'm gonna dry the area using a gauze sponge in the same manner. And I'm gonna apply an ointment or even betadine using a sterile cotton pledges or perform other treatments as ordered by the physician. Ita-dry ko lang po. After that po is I'm gonna apply a layer of dry sterile dressing over the wound. Forceps may be used to apply the dressing. So after applying the first layer, I'm gonna place a second layer of gauze over the wound site. I'm gonna adjust the gauze depending on the wound drainage. So, I'm gonna apply now the elastic bandage or surgical or abdominal pad over the gas at the site as the outermost layer of the dressing, and I'm gonna secure it with that tape. So after securing it with the tape, I'm gonna label the dressing with date and also time, and I'm gonna remove any discard or used gloves and all remaining equipment, and I'm gonna place the patient in a comfortable position with side rails up and bed in lower position. Lalagyan ko lang po ng time and date. Okay. Ma'am, comfortable naman po kayo sa position niya. Okay po. I'm gonna discard all the materials used. I will now remove my PPE and I'm gonna perform hand hygiene. I'm gonna remove my gloves now. Perform this. And lastly is I'm gonna document the evaluation. So that's all for my written demonstration. Thank you, ma'am, for watching, and thank you, ma'am, for listening.